Hello guys, welcome to our channel. Today we are discussing about the hypertension. Persistent high arterial blood pressure is called as a hypertension, defined as a systolic blood pressure above 140 mm per Hg, or also called as mm per mercury, mm of mercury, or diastolic blood pressure above 19 mm of mercury. Means when there is a rise in blood pressure, this is called as hypertension. This is caused by the various factor. For example, if we take a long run to the ground, then there is a sharper increase in the blood pressure, which is also called as hypertension. Increase in the secretion of adrenaline is also responsible for the increase in a blood pressure, which is directly proportional to the hypertension. Let's take a look towards the hypertension. Hypertension is an increase in the blood pressure, or hypertension is generally called as a silent killer. Silent killer means when we are sitting at the one place, or we are thinking about the various thing in our mind, these things can also be trigger high blood pressure or hypertension. Generally has no symptom unit. Generally hypertension is shown by obesity, means fatty peoples commonly suffer from hypertension. It is also hereditary or lifestyle. City lifestyle is also responsible for the hypertension. Symptoms of hypertension is different in every individual, depend upon the blood pressure, age, medical history of individual, etc. Hypertension is determined by absolute and relative blood pressure level calculated by the cardiovascular risk estimate for factors like age, gender, smoking history. These are also responsible for the hypertension. Excessive smoking is also lead to hypertension, or which may cause cardiovascular problems in the individuals. Types: essentially or primary hypertension. Its cause is unknown, or 90% of the people suffer from this hypertension. No symptoms, or may experience headache, tiredness, dizziness, nosebleed. Obesity, smoking, alcohol, diet play a role. Our diet also play a role in hypertension, as we eat junk food that increase the fat content in the body, which may also cause hypertension. Because of obesity, excessive smoking also lead to hypertension. Excessive alcohol take. Secondary hypertension is cause is known. Abnormality in artery supplying blood to the kidney, which cause secondary hypertension. Airway obstruction during sleep, which may also cause secondary hypertension. Diseases, tumors of the adrenal glands, hormonal abnormalities. Hormones play a very important role in our body that also increase or decrease the hypertension in the body. Thyroid disease. Too much salt or alcohol in a diet. Too much salt also lead to the hypertension, or alcohol also cause hypertension too much. Causes of hypertension: elevated systolic or diastolic blood pressure is called as a hypertension, which is caused by overweighting, excessive sodium consumptions, physical inactivity, means take a food, rest, take a food and rest. This also cause hypertension, means no activity is done by individual. Stress is a very important aspect of hypertension. Low calcium, low sodium, magnesium and calcium intake, excessive alcohol consumption. These are the various factors which can cause hypertension in an individual. Risk factors: abnormal high blood pressure may lead to stroke in our brain, or it also lead to MI, myocardial infarction, also called heart attack. Family history of hypertension, it is also heredity. Excessive salt intake also lead to hypertension. Excessive weight or obese, physically inactive person may also cause hypertension. Alcohol consumption. Excessive alcohol consumption is also lead to hypertension. Pharmacological effects of hypertension. Effect of hypertension is CVS, increase in the myocardial work, which lead to the angina pectoris or pain in the chest, or chronic artery disease or CAD. CAD is most common in the people's. CNS hypertension may cause a microancylomas, kidney shrinking of kidney, proteinuria means protein in urea, or it is also lead to malfunctioning of kidney, which may cause various disorders in the body. Management of hypertension. Pharmacological management, diuretics, which may cause many time urines in person, or sympatholytic calcium channel blockers, vasodilator, which dilate the vessels. Non-pharmacological management include reduction of body weight, sodium restrictions, alcohol restriction, diets, physical exercise. These are, we can control this activity in our home. Uncontrolled hypertension lead to increase in workload on the heart, which may cause heart diseases or abnormalities in the heart, damage of arteries in the brain or anywhere in the body. Atherosclerosis means there is fat deposition in the arteries, or coronary heart disease, which may cause angina. Strokes are also common. Transient ischemic attacks or kidney damage, microvascular hemorrhage in the brain and eye, which may cause bleeding in the brain or eye. Lifestyle modification. We can also control hypertension by a change in lifestyle in our day-to-day life, by loss of weight, limit alcohol, increase physical activities, or doing exercise daily, decrease sodium intake or salt intake in a food diet, keep potassium intake at adequate level, take in adequate amount of calcium and magnesium, decrease intake of saturated fat and cholesterol or junk food, stop smoking. Home remedies are, these are the home remedies. Grind equal quantity of dried watermelon seeds and poppy seeds. Take 1 teaspoon of the mixture in the morning on an empty stomach and again in the evening, and mix 5 to 6 drop of garlic juice in a 4 teaspoon of water and take it twice a day. Conclusion. As epidemiological studies show that the hypertension is increased exponentially in a country, so person must understand healthy lifestyle, proper diet, proper sodium intake, etc. for maintaining the blood pressure. Pharmacological management of hypertension has been shown the previous slide. Hence, the person with adequate given drugs can maintain their blood pressure and live a healthy lifestyle. These are the conclusions. Summary of hypertension. Lifestyle modification for prevention of hypertension is effective, quite effective. Change in lifestyle is very important for the hypertension, and management of hypertension is very important to reduce the risk factor of heart attack or stroke in the body, which increase the overload on the heart, which may cause heart disorders. Thank you friends for watching this video. Please like and share.